So let's kick it off. Today is the Recipe for Health Kickoff for all staff. My name is Stephen Chen. I'm the Chief Medical Officer for Alameda County Recipe for Health. I'm pleased to be here with my colleague, Julie Alvarez, who's the Clinic Program Manager of Open Source Wellness. Today, it's a twofer. You're going to get a short 10-minute overview of Recipe for Health from me, especially for folks who've never heard about it, and then 20 minutes of experiencing what it will be like when you refer to Recipe for Health for your patients into our behavioral pharmacy. So it'll be also a wellness experience for your staff, and it's a great way to kick off the new year. So let's just start with the fundamentals. Why Recipe for Health? Why all this food as medicine stuff? A few key reasons. Number one, an unhealthy diet is the leading cause of mortality in the US, believe it or not. This is 26 years of data which stacks risk factors against each other. So you'll see that at the top of the risk factor list, dietary risks out kind of hurt our community and our population more than tobacco use, more than high blood pressure use, or more than high blood pressure, more than high body mass index, more than glucose. All of these risk factors are associated with chronic diseases. And when you total it, we're getting hurt by these risk factors and chronic diseases at the tune of 500,000 patients a year attributed to poor diet. So that's a huge game changer, and people are finally recognizing that. Number two, when we actually start looking at the diseases affecting us through these chronic, through these dietary health, poor health issues, 6 in 10 of us have chronic disease. 4 in 10 of you may have 2 or more chronic diseases. This is from the CDC. And this is the leading cause. These diseases, these diet-related diseases, are the leading cause of death and disability. This is what we are managing in primary care and at FQHCs. And it's costing us at an annual cost for the whole healthcare system of $3.8 trillion. 90% of that is attributed to chronic disease. We have a fundamental role to play in addressing this. And we've been doing this for years and years and years. Let's throw in the third piece, food insecurity. We know that food insecurity in general will increase many chronic diseases. I'm going to highlight diabetes because it's often with us. If you are food insecure in the blue line versus food secure in the red line, and food insecurity, it means you just don't have access to healthy food to live a healthy life. So it's access, it's healthy food. It's not just any food, and it's actually to have the energy to live a healthy life. If you don't have those pieces in play, over the years, you have a twofold risk, a 2 times risk of developing diabetes just by being food insecure. And I name this because I know the MAs play a huge role in helping us screen for food insecurity in the clinics and setting it up for the providers that they have identified patients with food insecurity so that the providers can come in and say, okay, in addition to food insecurity, do you have a chronic disease like diabetes or hypertension or whatnot? Because if you do, put that in when you make that referral, that will allow for the health plans to cover this program for your patients. So poor health or poor diet, chronic disease, food insecurity, 3 huge reasons for the why and what we're dealing with. And so the nation is picking up this, and there is a national direction that's been set. At the White House Conference on Hunger, Nutrition, and Health in September, I was fortunate to be able to attend and represent us in California and Alameda County. There was a clear direction set. The White House National Strategy says that they're going to expand food as medicine to the 3 M's. What's the 3 M's? The 3 M's: Medicaid, Medicare, and the market. And if you look at their strategy, and I highlighted the key words, there is a call to integrate nutrition and health. There is a call to expand Medicare and Medicaid beneficiaries access to food as medicine interventions. When you get Medicaid and Medicare on board, the market follows. Secondarily, we here in Alameda County have gotten the attention because of our partnership with doing this. Congressmember Barbara Lee has already proposed a national food as medicine pilot modeled after the work we're doing with Recipe for Health together, with our focus on sourcing regenerative organic food. It's one thing to have food as medicine. It's the other to actually bring the production, the growing of the foods together into that. So that's the why. Hopefully that's enough to center you and share it, to get you excited about the what. And so now the question is, especially for those who haven't heard this, what is this Recipe for Health? I've heard about it, patients may talk about it. So I like to just say it's an integrative model of healthcare that uses food as medicine to address three endpoints. But let me unpack the first part. Integrative model of healthcare. That's us. We in healthcare are doing this work. We're kind of realigning, reincorporating food as a treatment possibility, not just for prevention, but for treatment and for reversal. Many programs are out there doing food-based stuff, but they're not integrated into healthcare. And so that's what we're doing together, and we've done that together. We are then able to better address food and nutrition insecurity and other SDOH. SDOH is that acronym for social determinants of health, like transportation insecurity and poverty. We can do that now in the exam room using a food as medicine approach, at the clinic level using a food as medicine approach. We support our existing work on reducing chronic conditions because we can now add to our toolbox to treat, prevent, and reverse chronic conditions. And we are taking a health and racial equity perspective. All the FQs, majority of our patients are BIPOC, and we are making sure that our patients have access to this type of food. More importantly, or in addition, I should say, because of the work we're doing, we now have policy and systems change. This is really exciting. Recipe for Health is a covered Medi-Cal service as of September 1st through CalAIM Community Supports. CalAIM is this whole huge, massive change Medicaid or Medi-Cal. As of September 1st, and you guys are doing it, you can prescribe our food as medicine work or program to our patients, and they will get it covered by the health plan. They will be able to get this just like when you prescribe antibiotics, blood pressure medicines, high cholesterol medicines, whatever. It is now part of the system. So then the question is, what is this food as medicine stuff? What is this Recipe for Health? Like any recipe, it has ingredients. These three ingredients I'm about to share are scalable so that we can do this work at the other FQHCs in Alameda County, as well as outside of Alameda County, and also as a model for the nation. The first ingredient is a food pharmacy. Think about it like a regular pharmacy that distributes all your pharmaceutical medicines, but this one is a delivery system that fulfills the healthcare team's prescription for food as medicine. So we are attaching, in a sense, a farm that can deliver this food that you prescribe to our patients. Not only that, though, we recognize that food is one piece, but you got to be able to sustain this and bring in other elements of a patient's life to make this sustainable. So we have a behavioral pharmacy, and that's what Julie's going to give you an experience of. Group and individual health coaching is offered to our patients to sustain the healthy life habits, to integrate and amplify the effect of the food into their lives. So again, we're doing this in partnership with the clinics. And then our team, as you've seen me come back and forth, food as medicine training, clinical nutrition education, as well as clinic and EHR workflow. When we do this, we work with the clinics, we work with the health plans, we implement, and that improves patient and community health. Ingredient number one, I'm going to just do a deep dive, about 3 or 4 slides, and then turn it over to Julie. First ingredient, food pharmacy. Let's get a little more visibility into that. We partner with Dig Deep Farms. They are a farm that has over now 120 acres of land, urban land, in Alameda County through a partnership with East Bay Parks and Rec. The most recent partnership is with Ardenwood Farms. If you've ever been there in Fremont, beautiful place. That's going to be farmland growing the food for your clinic and our other clinics. They provide a pharmacist, and in providing the pharmacist, they provide job training for justice-involved folks who come out of jail, coming out of jail, needing a job, folks in probation, youth programs, and victims of intimate partner abuse. They also use a regenerative organic farming approach. So when you prescribe that food to your pregnant patients or your pediatric patients or your adult patients, no pesticides, and this higher nutrient density food. And that is now brought to the patients, locally grown produce, bags, because of this CalAIM work we're doing. Weekly bags are sent to our patients' home for 12 weeks, and we've just got approval up to 24 weeks for extensions. So 3 to 6 months of this food to help change the habits and approaches for our patients. who have food insecurity and chronic conditions. And then doorstep delivery, 99% delivery. We have refrigerated vans dropping this food off to our patients' homes. The second piece that's really important about the food pharmacy is, where does the food come from? And so this is what Barbara Lee is very interested in, and looking at, well, beyond just getting food into healthcare, where does the food come from, and how does that change the food system? So we grow this food regeneratively and organically. We process it up at a food hub in San Leandro Hill. So when it's grown, it's brought there and then cleaned and then put in the bags. This is seasonal, fresh, local food, pesticide free, whereas organic gets rid of synthetic pesticides, and allows for some organic, if you will, or natural pesticides. Our regenerative organic doesn't have any pesticides. There's an intentionality to improve the soil health. And when you improve soil health, you decrease all the greenhouse gases, because you're bringing all that CO2 into the land and holding it into the land. It's called carbon sequestration, which then increases the nutrient density of the food, more micronutrients, vitamins, and whatnot. And when you consume it, your microbiome, your gut health improves. So improved soil health leads to improved planetary health, leads to improved human health. All right, we're getting close to closing. The second ingredient, the behavioral pharmacy for group and individual health coaching. This is what you're about to experience. It's super exciting. This is the partnership with Open Source Wellness. They provide staffing at your clinic to do group medical visits, where you can see 12 to 24 patients with different diagnoses. You can have patients with depression, anxiety, they can have diabetes. You don't have to remember which group do I send them to. Just send them to this group and they will get it taken care of. They will attend weekly sessions times 12 and get the following experience: movement with a movement coach, which you're about to experience; nourishment, where they're going to go over the food that they just got from Dig to Eat Farms; connection with health coaches and them and the patients together in small groups, learning from each other; and then getting texts and follow-up to work on their action plans and accountability. And then the final piece is a whole piece on being, mindfulness, stress reduction. This is happening at your health center. And if they can't make it at the health center, then it's happening countywide. We have countywide groups. You will have a provider in your group. For those at the county, there will not be a provider. And then thirdly, for the patients that can't do group, they go to the individual. We take care of all of that. You just make the referral. We'll follow up with the patients. The final ingredient is the food as medicine training for health centers. This is what our team does. You're part of it right now. Clinical nutrition training. Most of us in medicine only got 4 hours, maybe up to 7 hours of biochemistry. That was nutrition. It wasn't how to do it with clinics, patients. That's what we are going to be giving you in subsequent trainings. The MAs and prescribers without MAs, like the behaviorists, behavioral health teams, RNs, they will get training on how to ask about food insecurity in a culturally humble way. And then we are going to be optimizing access to CalFresh through just a click of the button of the referral, the CalFresh referral. We will do this through electronic health record integration and workflow integration. So 3 ingredients ready to go. We are spread across the whole county now, starting at Lifelong at the top, Native American, Diversio, Alameda Health System, Bay Area Community Health, and growing. And we've enrolled over 3,000 patients getting this food, 51,000 bags of food, 817,000 servings. And with that, I'm going to close and give you the experience in the next 15 to 20 minutes to experience group health coaching in the behavioral pharmacy through Open Source Wellness. Let me pause, because I've just been speaking really quickly though, and just quickly ask, are there any questions? And if not, I'm just going to turn it over to Julie. And now you're going to experience what happens to your patients when they get the Recipe for Health experience with the group coaching. Quick questions? All right, y'all. Thanks for listening to me. I'm going to turn this over. Please turn on your cameras. You're going to experience this together, because we do this through virtual sessions with the patients. We also have some sites that are doing it in person. With that, I give it over to Julie.
Awesome. Thank you so much, Stephen. Yes, so I'm actually going to ask Amel to pop on our slides right now. And so like I said, my name is Julie. I am the clinical program manager for Open Source Wellness. And I have Amel here with me today, and she's one of our coaches at Open Source Wellness, and she's going to be my co-facilitator today. And so just to give you a little bit of a roadmap of the next 20 minutes, I'm going to briefly share about where Open Source Wellness comes from and how we came into creation. Then I'll share briefly about the patient experience. What are your patients going to get? And then we're actually going to experience all of that together as a group. So Open Source Wellness was born out of the observation that doctors were giving out the same 4 behavioral prescriptions: exercise more, eat better, reduce your stress, and get some social support. I'm sure these sound familiar to all of you. And unfortunately, we actually don't have a place or a pharmacy where these prescriptions can be filled. So with that in mind, we created a pharmacy to fulfill on those behavioral prescriptions that we abbreviate as Move, Nourish, Connect, and Be. I'm sure you're asking yourself, all right, tell me about that patient experience, right? So it really all starts when you have that patient in the room or where you're in that telemedicine visit with them. And so they're theoretically in front of you, and you have them in front of you because they have a behaviorally mediated chronic condition, something along the lines of depression, anxiety, diabetes, or hypertension, right? Or one of the many others. And you say you want to refer them to a group, and you would say something like, I'm going to write you a prescription, but it's not for medication, but instead it's for a community that is focused on health and well-being. Together with them, you're going to be able to make and meet the health goals that matter the most to you. So that's what happens in the room with them. And then once you've made that referral, that comes over to us at Open Source Wellness. And as soon as you make that referral, your patient is going to receive a phone call from someone on the OSW team. And this isn't your average run-of-the-mill reminder call, hey, you need to be at this appointment at this time, but instead it's really a relationship-building phone call. This is where the patient really starts to be able to express what is it that they want to work on in their health, what matters to them, and why they want to change their health. So we really get to the why of why all of this matters specifically to them individually. And once we've had that conversation, we set them up to participate in our 2-hour wellness 12-week group. And whether that's on Zoom, we take care of all of that and support them in getting on, or if they're in person, we guide them towards, where's the address? How do you get there? Do you have transportation? Whatever it might be. So now that you know a little bit about Open Source Wellness and the patient experience, I want you all to experience it for yourselves. And for that piece, I'm going to pass it over to Amel so you can experience the Open Source Wellness program.
Thank you, Julie. Hello, everyone. My name's Amel, and that is now what we're going to do. We're going to experience all the 4 pillars of wellness we've just been talking about. So I would love to ask everyone to unmute, turn your cameras on if you can, and during any portion of this, please take care of your bodies and modify as needed. So with that, Julie, if you can get us with the music. We're actually going to start with some neck stretches, some shoulder rolls and leg circles. And then after that, we're going to show show some moves that we like to do. It could be some dance moves, any movement moves. So let's start with some neck stretches. So I'm going to look to my right, back to the middle, left, back to the middle, and then we're going to repeat this. I feel lots of tension. That just lets me know that I was not sleeping the right way last night with a toddler. And so next, if you would like, we're going to go look up and then back to the middle. I don't know if anyone feels that stretch. Back down, again to the middle, and then one last time, up, and then down. Okay, so we're gonna do some shoulder rolls now. You can go forward, backward, wherever feels good for you. Maybe even switching directions. So if you were already going forward, going backwards and vice versa. Okay, so if you're not already standing and if you would like to stand up, we're gonna do some hip circles, or you can go side to side, whatever feels comfortable to you. And as we're doing this, I would love for you all to think of one movement that you would like to share with everybody. We're gonna take turns and we're gonna do the movement with you. Okay, Julie, would you like to show us a movement? Arm circles, yes. We're going forward for some of us, and if you're already going forward, how about trying backwards? Thank you, Julie. How about Steven? What you got for us? Oh, Steven's coming with the dance moves. Okay, Steven. Thank you. And then who else do we have here? Does anyone want to share a dance move? One more last dance move or any movements? Rico, would you like to show us a movement? Yes, some stretching. This is perfect. Thank you, Keiko. Okay, everyone. That is all the movement that we're doing today. Thank you so much for participating. And if we can get the music off. So that is just a snippet of what we do at our programs. But we typically have a movement instructor that know what they're doing. So thank you for bearing with me today. So next we're actually going to be doing some movement. So we're going to practice mindfulness through meditation. So begin by bringing your attention to your body. You can stay seated. You can close your eyes if that's more comfortable to you.
You don't close your eyes, you're gonna fall asleep.
Yeah, that's definitely a warning there. Thank you. Take a deep breath. Bringing in more oxygen to your body. And as you exhale, have a sense of relaxation. Notice the sensation of your feet touching the floor. The weight and pressure, vibration, the heat. Notice your legs against the chair. Pressure, pulsing, heaviness, lightness. Notice your back against the chair. Bringing your attention into your stomach area. If your stomach is tense or tight, let it soften. Take a deep breath. Notice your hands. Are your hands tense or tight? See if you can allow them to soften. Notice your arms. Feel any sensations in your arms? Notice your neck and your throat. Let them be soft and relaxed. Noticing your jaw, and if it's tense, allowing your jaw to soften. Let your face and facial muscles be soft. And notice your whole body present. Take one more deep breath. And when you're ready, you can open your eyes and come back to the room around you. Okay, welcome back, everyone. Thank you all for being part of that meditation. So I'm going to transition us now into our activity today and part of our discussion. And today we're going to be doing the wellness scale with our hands, 1 through 5. And so for this activity, we're going to take a moment to reflect on our own well-being. So there's a lot going on around us between going to work, if we have kids, going back to school, maybe navigating the flu, COVID, the weather, just to name a few. So we're going to go through the 4 pillars of wellness: movement, nourish, connect, and be, and rate how they show up in our lives using our hands. So we're going to start off with movement on a scale of 1 to 5. How are we doing it with our movement, our physical activity? 1 being, what is exercise? What is sweating? Or 5 being, I'm very happy with the amount of movement I do right now. I think I'm gonna be a 2 right now. Okay, so I see some 3s, 2s. Got it. Okay, thank you all. So let's move on to our nourishment, how we eat and drink and nourish our bodies. One being donuts, Coke, chips, and pizza have been amazing in my life. And 5 being I nourish my body and eat a balanced meal on a daily basis. 1 to 5, I think I'm a 4 here. Yeah, thank you, Julie. Totally, you can use the chat as well. Yeah, see some 2s, 5s, 4s, 3s. Thank you all. Next, the B pillar. So how stress shows up. 1 being I find myself always feeling at max stress level, or 5, I am the Zen master. I would say it too. Oh wait, I did this backwards. I'm a 4. Thank you all. I see some 3s, 2s. Thank you all. And then lastly, connection. So 1 being I would love to feel more connected to those around me, and 5 being I have way too many meaningful relationships. This is one thing I'm proud of. I see some 4s, some 3s.
I missed it. Can you say it again? I'm sorry.
No worries. So we're at the connection pillar. And so 1 being I would love to feel more connected to those around me, and 5 being I have way too many meaningful relationships. Yeah. Okay. So thank you all for doing that activity with me. So we're going to talk about those reflections that we just made around our health and well-being. So with that, now that we have reflected on where we stand in the different areas of our health, if you are going to write a prescription for yourself to address the areas that need some extra attention, what would that look like? Or what would that be? Julie, do you have one for us?
Yeah, mine was a little bit, my stress is all over the place. So I think I would find things to do for myself. So just like spending quality time with me.
Spending more self-quality with Julie, like more self-care. Thank you, Julie. Who else? What is a prescription that you would like to give yourself? More reading time. Oh, I did not. Yeah, I agree with that one. I love reading as well. What else? And feel free to use the chat as well. I would love to include more movement. So finding a way where I can do indoor movement, or maybe even find a friend to do movements with. Choosing your battles. This can be a little bit more of like the connection pillar, maybe B pillar. Wow. We can take a couple more. Amal, do you have anything for us?
Yeah, I just dropped it in the chat.
Oh,
Definitely want to eat better. I was at a 2. So I definitely want to choose better options of things that I eat.
Nourishing our bodies and finding the different ways we can do that. Thank you. Stop doing after hours work. Yes, that's definitely one way to take care of yourself. How about Dr. Sugimoto? What you got for us?
That's a really good question.
That's okay. You're thinking about it. It's now into awareness.
How about shoot for 6 hours of sleep a night?
6 hours of sleep.
Yes.
Got it. Better self-care, maybe more connection with yourself. B pillar. Thank you. So that is more hot tea. Is that hot tea, Keiko? I think
Yes, hot green tea. Thank you.
tea specific. I love that. Thank you for sharing that. So thank you all for your shares and just the different prescriptions you are wanting to give yourself and supporting your health and well-being. So with that, that concludes our activity on our wellness wheel. Next, before I hand it back to Julie, I'm a little bit curious of what is one nugget from today's experience that you would like to share with your patients as you refer them? We probably gave you so many, you can't pick one. That's okay. Feel free to use the chat or raise your hands to share with the whole group. I'm gonna have to start calling names now. It's okay. Bonnie, would you have something to share? Nutrition and connection from Cassandra. Yes. Taking a holistic approach to making life changes. Definitely agree. Well, as you are thinking of that and putting them in the chat, feel free to do so even after this portion. Mindful moment, thank you. I will be, thank you all again, and I will be passing it off to Julie for our ending.
Thank you so much, Amel. If you can share the next slide on there for us. Yeah, so I briefly just want to share what the partnership looks like. So I'm partnering with Recipe4Health and Open Source Wellness being the behavioral pharmacy. What we provide is the entire program, really, right? So we provide the HIPAA compliant Zoom to make sure that our patient information stays safe. We run those weekly groups. We also ensure that all of the curriculum is really tailored to the participants. So we're always in conversation to what they want to learn and what it is that they need, so we can modify that curriculum to best suit those needs and get them the health education that they need. We also onboard them to Zoom. We know that sometimes a barrier to attending groups is not knowing technology and how to use Zoom. So we take care of all of that so that they feel confident enough to participate in a virtual group. And we also take care of the measures and the outcomes. So we track our participants, we survey them to see their progress of their health during the duration of their time with us. And then all we need from you is the one clinical provider to go ahead and be there during those group sessions to provide the medical support. They'll do the charting and the billing. And then from the rest of the team that's here is we need your referrals, right? We need you to talk to your patients about the group, about Recipe4Health to get participants in and really make the robust groups needed to support all the participants in our area, right? Thank you for that. And then our next slide, Amel. I just want to share one last thing is that at Open Source Wellness is that we believe community is medicine. And while individual medical care is great, what we found is the secret sauce to behavior change and motivation is the supportive community. And that means you all as providers, the peers that are in the groups, the peer leaders who have gone through a group and set an example for behavior change. And so we together really create community as medicine. Thank you all so much for participating, and I'm going to go ahead and pass it back to Stephen to close us out.
Thanks so much to Julie and Amel, to the Open Source Wellness team. Thank you all for the partnership. You just experienced just this very small, short experience of Open Source Wellness and what the patients will get. So make the referrals. Together, we're doing this to move upstream in the exam room, to move upstream at the clinic level. And we're making massive change. And so I've appreciated the partnership. I'm gonna actually open it up, or I'll also just mention that we do have kind of the, well, how do I do this section? We will have a training January 26th for all the prescribers and MAs. It'll be a joint training. So when I just pause, because we finished at roughly 30 minutes, and I know that you have 4 more minutes until close, I'll turn this over to you all. If there are any particular questions, I'm happy to hear any questions. Pause with that. And if not, what I can also do is just share one resource. For those who haven't seen it, we do have, and we'll be sharing more of this, but we do have this website. Can you all see the website? So when you look up Recipe4Health. Right now, we're going through a name change. We won't be All In anymore. We'll be part of healthcare services. But this is a site for you all. And when I say you, I'm saying the MAs and the prescribers. And the password is Recipe4Health. So recipe and then the letter 4 health, or the number 4 and then health. And when you enter it, you will have access to general resources here at the top. Where Dig Deep Farms, Open Source Wellness, all the various health coaching groups that are happening. Some of them are, you can see the Spanish county-wide one, And we want to make a plug because we've noticed you are all doing fantastic in your referrals, mainly English speakers, but Spanish folks can get this too. Spanish speaking folks can get this too. And we have a Spanish county-wide group, even if you don't have one at Lifelong, that's for Spanish. You'll see that we have patient and community resources here. And so in your AVS, we have a little dot phrase. We'll share it more at the next training. That will direct your patients to come to this page and they can get resources like the following: patient handouts, and all these different eating approaches in Spanish and English. We have videos on learn how to cook the various foods in Spanish and English. And we have recipe cards, a bunch of them here. So there's that. And then there's, if we go back to this part, clinic resources, there'll be this Recipe for Health Kickoff. We're going to replace this one as an old one that we did last year at Native American. We'll put this year's one with you all here. There's a training for prescribers without MAs. We're going to do that later with you all. We'll update that. We'll have a whole workflow training here that you're going to get in January 26th. And then you have a bunch of trainings like the one we did that was just the intro, and then a bunch of more in-depth ones. So just know that this is a resource that's available. Any questions? And then the last plug I'll say then is when you make your referrals, please associate a chronic condition. If you only put food insecurity, it won't be covered by the health plans. And we are finding funding to do that, but our funding is small. So the MAs under Amel's direction and Monica's direction have been fantastic, increasing the visibility of who's food insecure. The ask is of the providers then to think, oh, could this patient's depression be improved with Recipe for Health? Could their anxiety, could their diabetes or hypertension? And if so, attach that chronic condition to the referral. And in the visit diagnosis, when you're actually writing your SOAP note, enter those at the visit diagnosis level too, because when the health plans look at your notes, when we submit all of this stuff, they look and they say, well, they said, diabetes, but they didn't write it in their SOAP note. So the best way to do it is the visit diagnosis, or if you're doing an interim note, just write diabetes, poorly controlled, or not at goal. Good to go. Thank you all so much for your time. We hit the 9:30 mark and appreciate the partnership. And I'll just be here for any other questions. The question about password, it's all lowercase. So there you go. And William addressed it. So we'll pause and turn it back to you all, Naz and Amel and Dr. Sujimoto. Thank you all.
Thanks, Stephen. Oh, and my camera just went off again. Thanks, Stephen, for bringing your team here for that great kickoff. And I think just for a little bit of mindfulness and well-being was beneficial for all of us. And excited to move forward and hopefully even bringing more patients to Recipe for Health. And then I guess with all that, thank you everyone for being at the meeting today. If anyone does have any questions, Dr. Chen will be around for a few minutes, but I know others have to go and start seeing patients. So have a great day, everyone.